So what could we expect to change for us if many more of us were getting the vaccine? If we reached herd immunity, or a greater percentage of people getting the vaccine, what might things look like for us that would be different from the way that they are right now?
One thing that we need to be a little bit careful about, and I know the term herd immunity was used a lot earlier on, is that for a disease to be really successful at herd immunity so that we can, quote, eliminate it from our communities, I'll give you an example, measles, right? So measles vaccine provides very strong protective immunity that lasts a really long time, that lasts a lifetime for many people. And so with measles, we can have herd immunity, but even with measles, we estimate that 95% of the community has to be vaccinated in order to have that, in order to protect the 5% that weren't vaccinated. If you drop down to 80% being vaccinated against measles, you will have a lot of the people who weren't vaccinated get sick. So you have to, in the case of measles, and some people can't take a vaccine or they may not respond to a vaccine because they're really immunocompromised. But for example, a newborn, a young infant can't have measles vaccine. And when we see outbreaks because communities don't have enough people vaccinated, we see cases in infants and young kids, and they end up on ventilators, and it's really hard. Let's go back to COVID. So we're just learning about immunity and how long it lasts. We haven't really had the experience that we've had with measles where we know how long it lasts. We do think that immunity lasts for at least 6 months, but we suspect it's not going to be lifetime because we're already starting to see some breakthroughs. So we will follow it. We'll make recommendations about boosters, but what we're aiming for is control so that our hospitals are not overloaded with patients. And it's very challenging when hospitals are full of people with severe COVID because they can't attend to people who have strokes as well. They can't attend to people who have cancer. They have to stop surgeries. And we have had people in the United States who've had, say, a heart attack, and they are not able to get a place in a hospital because the hospitals are too full. And so what we're aiming for is to have some control, to lessen by far the number of people who have severe illness from COVID. And we think vaccines are very powerful in doing that, lessen the amount of COVID that is being transmitted, and lessen the impact on all other areas of health.